Well, good afternoon, everyone. I hope you all have had a great lunch break and got some food and are now ready to learn even more. I'm Lisa Garcia. I'm your moderator for this session. This session is entitled English, Health, and Literacy, and it will run for an hour and a half. Before we get started, though, I do want to remind everyone again to remain on mute during the session. Also, we love questions. The presenters in our session today will be pausing periodically to answer your questions. So if you have any burning questions for them, please type your questions in the Q&A section or the chat sections and we will get them answered. And now I will turn it over to Dr. Dory Ragotas and her fellow presenters.
Hello, everybody. Welcome to Health Literacy during the time of COVID. We're going to talk a little bit about a number of different programs. So our agenda for today is to look at when we started a COVID series in March and then our summer programs. We'll also be looking at a Friday series that's been ongoing for the fall. And then we're going to have a learner's experience and who has been in many of these different programs. I do want to mention that the names on this screen, except for Naomi and mine, are all students or former students of Western who have done a lot of this work as interns. So if you are a Western student, pay attention to what they're talking about because you might be able to intern for KLC as well. So I'm going to start a little bit with the COVID-19 series that we started in March. This is a little bit about me. I actually have several roles with the KLC. I'm basically a health literacy consultant. I run the tutor forum for health literacy. I'm also a coordinator for a community literacy center, and I'm newly retired from Western, although I still teach there, so I guess I'm partially retired. The COVID-19 series, we realized in March that all of us were bombarded with a lot of information, and we needed to work with learners to understand some of that information. All of us needed learning to understand that. So we started this 5-lesson series. It was for learners and tutors, both English learners and literacy learners. It explained the vocabulary that was used by the media and some of the diagrams that people were using. It was really important to explain the science so that people understood that part of what was happening here is that we had emerging science, that it's a brand new virus. So it wasn't that people were changing their minds as much as we were learning things as we went along. We also used available resources so that people could go to the CDC, for instance, or WHO, and look at some of the resources, or use, for instance, posters that were up in a lot of different places so that people could see some of that. We had interactive elements that teach literacy as well as health. Actually, we are a literacy center, and I'm going to show you some of those interactive activities. There are PowerPoints that are available on the KLC website for this series, and I would really encourage tutors to use this. I think that it's set up so that so people could use the PowerPoints individually, and I think that you can make adjustments for your individual tutor needs. It's a 5-lesson series. Started out with stopping the spread and what to do if you get sick. These were both based on popular posters that CDC put up. Then we went into what's the screening and the testing all about, and the CARES Act. Our 4th series was a little bit on stress and pandemics. And the last one was about contact tracing and then what to do with moving forward. So the series is set up so that Juanita over here on the right side of your screen is the person that was always looking for information about COVID-19. She wanted to know how to avoid it. What do you do if you get it? And she worried about her family members here. So her husband's over here. Her 65-year-old mother lives in the house with them, and she has a 10-year-old daughter. So that enabled us to kind of look at all these different elements of COVID. And she would, go somewhere and have questions about it and need to learn some of the vocabulary. So I introduced some of the vocabulary. And like I said, these are lessons for learners learning how to read and learning English. So we would do a lot of the reading of the lessons together. These are some of the things that she didn't understand in something she read. And so then we go and talk a little bit about the vocabulary. And then we'd introduce a number of elements that could go into more detail. So for instance, this clean and disinfect, we could introduce more issues so that she could understand it more and talk about it. And then we could move on and actually use annotation. And I'm looking for my annotation. Let's see. Sorry, I came up in a different place this time. So there. And you could say, so what should you disinfect? And you could say, okay, should we disinfect our skin? And based on what we just covered, we can open it up and people could talk about it and say, should we or shouldn't we? Should we disinfect our phones? Should we disinfect a doorknob, a cucumber, a mouth? So we could use the annotation in that way and get the whole class involved in the process. Oops. There we go. No, I lost my PowerPoint. Just a minute. There we go. Okay, so I'm not going to show you more of the annotations, but there are annotations for some of these other ways in which we presented some of the information. So if you're a tutor, think about some of these things. So you could do a fill in the blank, and the class, or if you're working individually, you can have them figure out which of these words fits in here. And there's an annotation that you can actually type in the word. And look at that together. We also could do scrambled sentences. So you can have a group of words and then have the learners put those words into a sentence. Really helps with the grammar. And these are all things that we, were aware of in the beginning of COVID and now. And then at the very end, so we'd have this scenario with Juanita and what she's learning, and then at the end we'd look at what kind of things she put in place for her family, and then the learners could make a plan for their own family. Now this is something that was harder to do in a class. We could talk a little bit about it, but individually, if somebody's using these PowerPoints, they can actually work individually with that and make it much more individualized for that learner and their family. So before we go on to Taylor's, I would like see if there's any questions.
Does anyone have any questions for Dory right now? I don't see any in the chat yet.
Okay. We'll have some time at the end as well, so maybe we should just go forward.
Sure, let's do that.
So I'll turn it over to Taylor.
Hello, everyone. My name is Taylor. I'm the KLC Parent Literacy Navigator. And as Dory mentioned, I am a former WMU social work student. And at the beginning of the pandemic, I was still a student and started this as an internship. So I've had the pleasure of going from that internship experience and gaining kind of that foundational knowledge to now working in a professional role. You can go to the next slide, Dory. Thank you. So I'll talk to you a little bit about our Read and Seed Summer Health Literacy program. Typically, the summer session of Read and Seed is a really exciting time. Adult learners and their families are actually invited into our community garden at Goodwill for classic, dirty, hands-on fun, because literacy activities can take place in the garden, and the class attendees can collaboratively work on garden activities around the lessons. With the help of a harvest contract, learners can even take home some of the harvest after the sessions. Basically, the harvest contract outlines that they can attend the health literacy class and participate in the upkeep of the garden with a certain amount of hours a week to then take home produce that is harvested from the garden itself. So some of the activities that they previously would be involved in would be weeding, harvesting, inventorying produce, food demonstrations, and making garden signs, among other things. Obviously, because of COVID-19, we had to rework the way that Read and Seed happens because we could not invite people into the garden this year. But we still wanted to highlight the community garden because it was such a fun place that the learners like to spend time and they love to observe the growth that happens in the garden over the course of the summer. So the Read and Seed summer program uses SNAP education curriculum to teach content around diet and exercise. It's a SNAP Ed compliant course. So for those who may not know, SNAP stands for Supplemental Nutrition Assistance Program. It's government funded to help the food budget of low-income families. It focuses on giving families the knowledge to both shop for healthy food and affordable food. So during the session, we use two separate curriculums. The first one is Cooking Matters. So Cooking Matters was primarily used in the first portion of the summer session. We would do recipe videos, and like you're seeing now, we would do, thank you, we would do some of the recipe demonstrations through pictures. The Cooking Matters curriculum is focused on ending childhood hunger by helping and empowering families to make healthy and affordable food choices. The other curriculum is My Healthy Snap, which is already a web-based program. It follows the answers that somebody is to give it, so it's self-guided and it responds to the habits that the learners or whoever says that they already have. So I turned this into a group setting and tried to take a general path, but we always encourage learners to continue doing it on their own and the individualized experience as they desired. Now you can go to the next slide. Thank you, Dory. So this is an example of how we did the recipe. So as I mentioned, we had someone who did do videos in the beginning. They were cute, 2 to 3 minute videos of her making the recipe spliced together. And it was really, really awesome. I opted to do pictures just out of accessibility. So what I would do is I would show the recipe, which was always something that was a recipe structured around SNAP benefits. I would show pictures every step of the way. I would outline what the ingredients are, what it looked like when it was finished. And then usually we would talk about the budget breakdown roughly, because everyone shops in different places at different times. And we would talk about food labels and what does the nutrition for it actually look like. So this was a great way for us to have conversations about you know, what's in your food? Do you understand, you know, what you're looking for when you need specific nutrients, or how to put together something that's affordable, can, you know, has the right amount of servings that you need for your family, etc. Amongst diet, the learners were super interested in exercise. We talked a lot about exercises that you can do at home, do with minimal equipment, or even do it with things that are in your home, such as a water bottle or, you know, a bag of flour, something that you could easily grab and might have. So this is how we did the exercise demonstrations. We would show what the format should look like. I picked 2 exercises a week for different areas of the body. And then we would often give additional tips about, you know, proper form or exercise safety to ensure that when they did try to complete the exercise, they were doing it as safely as possible. This is an example of how we use the My Healthy Snap in a group setting. So this is from a lesson on bulk buying, which discusses how, you know, it's often cheaper to buy in bulk depending on what you're buying and your family size. So it went over the concept of unit price versus retail price. So this was an awesome visual that the self-guided web program actually gives to show what the difference is when you're looking. You can go into the next slide. And then this is the way that they allow people to practice. So we actually did this in a group setting, and if they were to take it on their own, individualized, they would get similar activities with more opportunities to do the same thing. So if I was teaching this, I might say, you know, if we look at retail price, which one is cheaper? We would, you know, say the one on the left. But if we look at unit price, which one is cheaper? And this would often lead us to a discussion about, you know, it's only cheaper if you can use it. So if you have the right family size to use the product before it goes bad, then buying it where it's more, you know, up front, so it's in bulk, makes more sense. But if you end up throwing away half of it, then it doesn't really make sense because you're not saving money that way. So we had a lot of discussion about, you know, the mechanics of how things work to kind of put it into perspective. And this is how we use the community garden. So we would give picture updates frequently throughout the lessons to show how things were growing, what was harvested. When things were weeded and look new, we would talk about the work that has taken place since they last saw a photo. So the first 2 photos from the left to right are photos of the main bed. And this particular photo is from when we had an invader in the garden. So on the right side, you'll see you'll see a veggie that was eaten by something in the wilderness, something that got into our garden. And the learners had a great time discussing, like, what do you think it was, you know, based on what you see, what could it have been? And yes, the spoiler alert is that it was a groundhog. So we had lots of fun discussion to be able to track the progress of the garden over the course of the summer. And to encourage more learner participation, we asked them to send us pictures of their gardens. So not all of them had gardens, so we would encourage them to talk about, you know, the garden that you wish you had. What would you grow? How would you take care of it? We talked about how to take care of different plants or different vegetables. Or we had a couple people during the duration of this session actually go and buy like one plant in a bucket that they could take care of on their patio if they live in an apartment, or even keep it by a window, just to kind of be a part of the fun, you know. So this was actually some pictures of one of our learners' gardens who she sent in, and then she would have time to tell the class about what she's growing and how it's going. And it's just a nice way to kind of get them further involved and empower them to continue, you know, putting what we're doing here to use in their everyday life.
Now we have some time for questions.
If anyone has any questions, please put them in the chat.
We can go back to questions then.
Sounds good.
Did you have one?
They want to know if you caught the hedgehog groundhog.
No, they're awfully sneaky. But I don't think we had issues with it again. They got to a couple vegetables during that time. And they put a fence up around the garden, so we didn't have any issues with any, sneaky animals. Yes, a deer fence, that's what it was. So we learned our lesson.
Sneaky groundhogs. Okay, let's move on. And if there are any questions, I'll pop in.
Okay. So the next thing is, actually this was going on simultaneously, is an English plus literacy plus health program. This is something we've done for the last 3 years. This is actually my second role here as the coordinator of the Community Literacy Center. So our church literacy center, the KLC and the Refugee Resource Collaborative kind of collaborate on this program every year. This was the first one we had online. The first 2 years were at the Methodist Church, and we had childcare and other kinds of things. We do hire ESL professional teachers for this. It's 3 levels in the morning and 3 levels in the evening. And it's Monday through Friday for 5 weeks. From this year was from July 8th to August 8th. We had 77 online attendees. The year before we had 90 between the morning and the evening time. So they either go morning or evening, not both. So the challenge was, of course, as we know, is to change this to something virtual. And I know that Jackie's going to talk a little bit about some of that transition to virtual in another workshop, but I wanted to talk a little bit about what this meant for like volunteers for the summer program. So before 2020, our volunteer roles were some on-site registration. So we hired, or we had volunteers who came in and interviewed people and talked with them about their goals and looked at how much English they had. This program was for English learners solely. And then we also had to do the CASAS. The CASAS is a test that measures what level English somebody has. And it's an online test. And we would come in and help them navigate the online test, but then they do that themselves and we could place them in classes. So we had volunteers that did that proctoring the online test, or they were sitting in the church, but the test itself is online. And then we had on-site classroom assistants that would kind of help when you would turn and want people to talk more to each other. We had receptionists, because as you can see with all those people coming through, we had to get them to their classes and sign them in, make sure we had attendance and things like that. We had snacks, and many of the people in the church did snacks for these programs that were 2.5 hours and had a snack in between. One year we did SNAP Ed education, so we had tutors that did cooking, Burlington English, and some straight tutoring in another summer. And then we also had childcare in the morning. We didn't have childcare in the evening, but we did have it in the morning so more people could attend. So the volunteer roles this year were quite different. So we had to have a telephone registration. So we had volunteers that registered people through the telephone. Sometimes we had one volunteer who spoke Spanish and helped to register people. Usually we do everything in English, but because of the distance, we did do some of this in Spanish this year. We also, we did have to work with some relatives or some interpreters for other people that had very low English to register them. And then the CASAS at that time, you couldn't proctor online, and now that's changing, but we had the registration and placement together, we had to kind of, the volunteers had to kind of look and see what people's English was like to try to place them in an appropriate class, because we had them by levels in the classes. We also had technology volunteers. So we had a student from Western who put together a PowerPoint for these technology volunteers to kind of talk somebody through how to get on WebEx or Zoom. And then we had online classroom assistants. So if something happens to the teacher's technology, the online classroom assistant would have to take over the class. They also did the attendance in the class. They participated depending on, you know, what their teacher was working on. And they went to the breakout sessions for some of the classes as well, so that people could have more practice with speaking their English.
Dory, before you move on, there was a question in the Q&A.
Okay.
Can you use SNAP at farmers markets?
Yes.
Great. Thank you.
Taylor, did you want to talk to that? I know that they can. Is that the double down? They do that with
Yes.
SNAP, right?
Yep, we do double up food bucks for SNAP benefits, and we did talk about farmers markets to the learners, and we more intentionally talked about actual SNAP benefits, what it covers, what it doesn't cover, and then using the double up food bucks on top of farmers markets having that. We also have several stores around Kalamazoo and furthermore around the state that honor double up food bucks for people that receive SNAP benefits as well. So we talked a lot about how that works and where they could go to receive those.
Can you briefly tell us how it works?
Yeah, they get double, basically $1, they get double, so $2 for like produce that comes from specific stores and the farmers markets. So it's additional income if you shop at the specific stores or go to the farmers market. They get double what they get in the regular benefits. And they don't need to do anything prior.
Yeah. So back to the summer program. So I'm just going to show you a few ways in which the teachers taught in that program. So in some of the earliest English levels, there was they used alphabet PowerPoints. So they do like ear, and you know, they could go through E is for ear, and where people are learning alphabet, and then, you know, be repetitious with that. And then you later on could do something about you're going to the doctor and your ear hurts. What will you say? Something like that. Also, many of the teachers used whiteboards. So they took the whiteboard and they could hold it up to the screen, and you know, it could say something like, let's say you want them to write ear and practice writing ear. You could actually put that up at the screen and the teachers could check everybody's whiteboards. Many of the things that I showed you in the earlier PowerPoint could be done in this summer teaching program as well, but also reading conversations. So you could, the doctor, one person could be the doctor, maybe the classroom assistant is the patient the first time, and then after that, each of the learners would go through this, giving a lot of time for speaking. And then the breakout rooms were popular in the more advanced classes. And this is where people could get a lot more attention, because it's more, you know, you have fewer people and you're face to face. So, you know, PowerPoints are wonderful, but you can't really see the other people. And learning English, it's helpful to be able to see each other very well. So I think that was used quite a bit. Even in the early classrooms, they would take the PowerPoint away for a while so that everybody could see each other, you know, in full screen and talk. And do we have any other questions, Lisa?
No, not right now.
Okay. So I think I'll turn it over to Haley then.
Hi, everyone. My name is Haley, and I'm a student from Western Michigan, and I studied interdisciplinary health services, and I'll be graduating this December with my bachelor's degree, and I joined the KLC in September as a health literacy instructor. So you can go on to the next slide. So the lessons I covered within the health literacy curriculum centered around being a patient within the healthcare system. We discussed the process of finding a provider, and in the second lesson, we went over an educational tool called Ask Me 3. And then lastly, we went over important things to do after an appointment is over. So we'll go on to it. Oh, I think you have to go back one.
Did I skip one?
Yeah, no, you're okay.
There we go.
Thank you. So lesson 1 was used to discuss what to do before you go see a doctor, as well as lay down a foundation as to what a healthcare provider is and why they're important. We also scratched the surface of discussing insurance. It's very confusing, so I didn't want to go too into detail, but it was just something that I figured to include as for like in-network provider or out-of-network provider, just to lay down a good foundation. And these were the vocabulary terms that we went through in the beginning of the class, and we reviewed them with some vocabulary matching at the end as well. We started out by defining what a healthcare provider is, and then going on to primary care and health insurance. And we kept the definitions short and manageable. Some of the key topics we discussed in this lesson were qualities to look for in a provider. We went over some options for if you don't have insurance as well. And we also provided some links to local facilities that will treat you if you don't have insurance. We ended the lesson with some discussion over important questions you can ask clinics before you go to your appointment. So for instance, we asked, like, do you accept my health insurance, or can I get to your place using public transportation, or how much will it cost to pay out of pocket if you don't have insurance? Go to the next slide. So for lesson 2, we covered an educational tool called Ask Me 3, and this was developed by the Institute of Healthcare Improvement. I actually learned about this tool in some of my health service classes through Western Michigan, so future healthcare workers are being made aware of this, and Bronson healthcare workers also implement this as well into their work. The first course of action was to explain what it is, and it's basically an educational tool that patients can use to effectively communicate with their providers, or any healthcare provider for that matter, in order to better understand their health. It helps to build confidence when talking to a doctor by just asking the 3 simple questions. What is my main problem? What do I need to do? And why is it important for me to do this? And this was a slide from my lesson explaining to the learners what Ask Me 3 is and why it's important for them to use it as well. So it's basically a set of questions you can ask when you meet your provider. It helps you understand the information and it helps you talk to them. You can go to the next slide. So I also decided to implement some research into this as well. And during my time as an intern, I made this my honors thesis. So I've been working on a study that involves teaching the crash course Ask Me 3 to learners of the KLC, and was collecting data using pre and post surveys. These surveys basically just gauge the learners' confidence levels when you talk to your providers. And it's basically, we give them a pre-survey and then we teach the lesson, and then you get a post-survey with the same questions. And this is because communication is really important when visiting a doctor, and this tool can really benefit those who may have difficulty with this. You can go to the next slide. And then also for the Ask Me 3 lesson, I decided to include a video depicting a real life example of a patient using Ask Me 3 when they visit their doctor. And I had the learners tell me what they heard from the video based on the doctor's responses. So the patient would ask, what is my main problem? And then the doctor responded, you have congenital heart failure, or something like that. And I had the patients reiterate that to me based on their memory. They did very well with reciting this. And by advocating this tool and educating others on it, we can help lower the health literacy barrier in our community and keep patients in our healthcare system safe. You can go to the next slide. So the last lesson, we talked about what to do after your appointment is over, such as following your doctor's instructions, like picking up a prescription or possibly getting another medical test. We went over some reasons as to why you might need to schedule an additional appointment, perhaps for a follow-up visit, or if you need to go see a specialist for a specific reason. And then another topic I decided to add into this lesson were some medication safety tips, because many patients get prescribed medications after they see their doctor. And yeah, we went over the importance of keeping track of your medicine. You can go to the next slide. So this is a medication label that I decided to use. And this patient, Jane, was prescribed amoxicillin for an infection that for an ear infection that she was diagnosed with. And her prescription label would likely look similar to this one. We went through each arrow and matched the colors to determine like which part of the prescription label matched with that. And we used animations to help show the learners each part of the label without it looking too cluttered with information. So we began with like finding the patient's name. And then we worked through the rest of the label, finding the medication name. We looked for the dosage and so on. So after learning more about the patient and the medicine that she was given, I had the learners help me fill out Jane's medicine list. I made this one using Microsoft Word and just made the names, the headings of the medication list: name, dosage, color, what it's for, and the time you take it. Again, this slide, you just utilize animations that allowed me to ask the learners what should be written under each category based on what the learner learned from the story and the prescription label that we went over. So neither of them actually indicated the color of the prescription, but just for reference for the lesson, I just said that they were red and yellow. And I told them to make observations of pills that they actually would have in person. So just open it up and look at it. And then we ended the lesson with some vocabulary matching and fill in the blanks. But if you see with the animations, it really was like fun to engage them with those and talk about it and make sure they understand the importance of keeping track of the medication that they take. And I believe that's all I have.
Do we have any questions?
Yeah, Haley, I have a question. You mentioned that you had conducted a research study on Ask Me 3, and were there any interesting findings that you would be able to share with the group?
So the study was used, I talked to people, it was originally used with tutors as well as like implement into the Ask Me 3 lessons. So we did put in the crash course into one of our lessons. I had a few responses with pre and post surveys. I did notice that it did build learners' confidence from the responses I did receive based on asking the 3 questions. What is my main problem? What do I need to do? And why is it important for me to do this? So I did find that it did help increase those, whether it be just like on a scale of 1 to 5, like if a learner was at 3, they did maybe go up 1 more to 4. But yeah.
Wow, that's great. There are no more questions at this time.
Okay. So let's go on to Madison.
Hello, my name is Madison. I'm an intern at the Kalamazoo Literacy Council and an interdisciplinary health student at Western Michigan University. My work with the health literacy class included presenting 3 lessons that covered the importance of maintaining your health, getting proper exercise and proper nutrition, as well as the SNAP education program. My first lesson covered maintaining your health. For this lesson, some of the main topics that we discussed included the risks of living with an unhealthy lifestyle. We talked about things like developing new health conditions or worsening your current health conditions. We also discussed some of the important ways that you can take care of your health and live a healthier lifestyle, like getting enough exercise and avoiding unhealthy substances. And can you go back?
Oh, I'm sorry.
And then we ended by talking about the benefits of taking care of your health, and at the end participated in some review games before ending the session. Next slide. This was one of my slides from the presentation where we quickly went over the main ways that you can take care of your health before we talked about each one in more detail. Most of this lesson consisted of explaining each one of these categories and giving tips for how to be healthy in each category. We discussed healthy nutrition and eating habits, where we talked about the daily recommendations for food servings, which is given by My Plate. We discussed getting good sleep and things you should do and what you shouldn't do before going to bed. We talked about exercise, avoiding unhealthy substances like alcohol or using them in moderation. And then we talked about taking care of your current health conditions and the importance of visiting the doctors when you're sick and attending regular checkups. Next slide. This is another slide from my presentation. Here we talked about healthy sleep habits and the recommendations for getting good sleep. I also asked the learners to talk about what helps them sleep well and let them share their ideas. And I try to add questions like these to most of my slides because it helps bring up conversation and get the learners involved. Next slide. My next lesson covered exercise. Next slide. The topics in this lesson covered the importance of exercising, such as the many health benefits. We talked about ways you can exercise from home and shared examples of at-home items that can be used as exercise equipment. We talked about ways you can get your family involved, both for adults and children. And then we talked about activities like helping your children practice with sports or doing house chores together as a family. And then last, we talked about how to exercise safely during COVID-19, such as staying 6 feet apart when you're exercising with others. This is an example of one of the exercises that we shared about that can be done from home using common household items. So with this exercise, you could use a chair. We also talked about using things like milk jugs or as weights, or using a rug as a exercise mat. Next slide. And my last presentation covered nutrition and the SNAP assistance and education programs. Next slide. In this lesson, we discussed SNAP Ed and My Plate, where we talked in more detail about the recommended daily nutrition and food servings, and then listed tips on how to get enough of each food group. And we talked about ways you can involve your family in nutrition and healthy eating. We also discussed activities to do with both children and adults. Things like letting your kids help pack their lunch for school, or splitting the roles and preparing dinner with your spouse. And then last, we talked a little bit about SNAP assistance program and ways to save money before, during, and after grocery shopping. For example, we talked about storing your food once you get home the proper way, or how to compare prices at the grocery store or look for coupons. So this is a slide from my presentation where we talked about a food group. I would tell them the daily recommended amount of each food group, and then list some healthy options for that food group. I also included a hand comparison to the portion size, so that the learners could have a quick way to see how much they need if they didn't have access to measuring tools and equipment at home. Next slide. Next, I would list tips on how to get the daily amount of recommended serving of each food group, and also listed other tips to look for when purchasing each type of food group. Next slide. And one topic that made an appearance throughout most of my presentations was involving the family and healthy living. We talked about how important it is to get your family involved in a healthy lifestyle, especially for children, as habits are often learned young and carried through adulthood. Next slide. This is one of my slides that discuss involving family and exercise. We talked about activities that the learners could do and also discussed their own ideas and what they like to do at home with their family. Next slide. And then this is also another slide from my nutrition lesson, where I showed the learners how I get my own family involved in nutrition by making it fun, and we talked about things that we could do with our children that involve nutrition. That's it.
Madison, just a quick question. Out of all of the lessons or presentations that you gave to the learners, which one do you think the learners responded to the most or they liked the best?
I think that the nutrition lesson, I had more people involved who talked a lot about things, and they really had good conversations through that lesson.
Well, that's great to hear. There are no other questions at this time.
Okay, so we're going to turn this over to Julia.
Hello everyone, my name is Julia Stebbins and I am also an intern from Western. I am a Master's of Social Work student and I'm also the empowerment group leader. I taught 3 lessons for health literacy on COVID-19 and mental health. Next slide. So yes, before I began teaching my lessons, I sent out a survey to understand what our learners' experience with COVID-19 was. For example, how it has affected their personal lives, be it from jobs, stress levels, sickness, and if they have known someone or lost someone to COVID-19. So when we began our lessons, there were 3 main focuses. Of course, it was COVID-19, the overarching one. And our first lesson focused on what is it and how to stay safe. We also talked about misinformation and how to talk to family about COVID-19, especially young children, and how to manage the online versus in-person school question or difficulties that arise during that. When we talked about what COVID-19 is, we of course have new research and information out, so we reduced the emphasis on sanitizing. And we refocused our attention on mask wearing and staying 6 feet apart because, as research has shown, COVID-19 spreads more through the air than it does through surfaces, although we, of course, we're conscious that it still can spread through surfaces. It's just a little bit less likely. We talked about the resources that were available during COVID-19 from the CARES Act, as well as local resources. And finally, we talked about mental health during COVID, with our focus being on managing stress. As we all know, this pandemic has revealed a lot more anxieties and stress that we all have, and managing it can be more difficult than we thought. So that lesson we just finished today, and that included some good discussions on how to manage our stressors, how to cope, and what we can do when we need help. Next slide, please. Each week was structured very similar. We started with vocab. We would get into our main lesson. Finally, we would review what the students had learned with some matching activities and fill in the blank. And at the end of the lesson, we would always include a preview of the next week's lesson. Here's an example from one of the slides that we talked about misinformation. For the 3 lessons, we talked about the character David and his family to bring the lesson to life. This slide was pulled from the misinformation where David is concerned about getting COVID and asks a friend, Paul. As you can see, his friend doesn't have the best advice. His friend Paul tells him to drink hot water and do a handstand to prevent COVID-19. Hot water was a rumor that was going around. I remember at the beginning of the pandemic, and doing a handstand was something I thought that the learners would get a little bit of a laugh out of. This example opened up the discussion of how do you know if something is true and where can you find reliable information? And this was something that we talked about. In this lesson, I guided the learners to the local health department, the CDC, and the WHO's Mythbuster website. And all three of those websites were influential in creating all of my lessons, as most of the information was drawn from those three websites. So next slide, please. Here's an example of what the lessons would look like. Here we have what to do when you're talking with your children and how to teach young children what they can do to stay safe. And right now, a lot of young children, it can be very scary for them. So it was important that you stay calm. These guidelines were pulled from the CDC's website. And here we stress the importance of modeling good COVID safety behavior, because as we all know, children mirror what adults do. What they see us doing, they want to do. And I liked this addition of the little girl with her teddy bear, because one of the advice that I found is to draw a mask on favorite superheroes or to put masks on stuffed animals. Again, help teach children that wearing masks is not only good, it is safe, it is fun, and everyone should do it. So finally, next slide. Finally, as we know, the information surrounding COVID-19 and the recommendations that are coming from our state and federal government and the WHO as well are changing frequently, even today. The week before this slide appeared in our presentation, we had gone over what the current guidelines for activities, social distancing, and meetups were. And at the time, it was a little bit more relaxed than what we are currently in Michigan, with a 3-week pause. That Sunday, Governor Whitmer announced the 3-week pause plan, and that following Friday, we included this slide that would explain the restrictions to a learner and allow them to ask questions and make it more accessible for them. These lessons were constantly adjusting and adapting, and that is one of the biggest lessons that I have personally learned from COVID, is how to adapt quickly. We wrapped up today with our mental health, and that included a good discussion. I was unable to include a slide from that in here, but it was a good resource for the learners, and we had some good discussions today. And that's all I have. Any questions?
Any questions, Lisa?
No, I don't see any.
Well, I have a comment. I think it's so wonderful to be able to go back and update the COVID-19 series I did in March. Of course, was based on what was happening in March, and you know, I also found that in March I had to change things last minute because things changed so quickly. But for instance, one of my lessons basically said, don't wear masks. They're not recommended, because they weren't recommended at that point in time. So we have to, I think that's one of the challenges of teaching health, is keeping up with this, and particularly in this pandemic. And I really appreciate how you've done that, Julia.
Thank you. And I'd agree, that was a bit of a challenge.
Yeah.
Playing catch up.
Yeah, exactly.
So for both of you, when things happen so quickly and change, and you tell the learners one week one thing and then the next week it's something else, how do you frame that for your learners?
Well, I talked a lot about this is going to happen because we're learning things as we go. And that's science. I think science is, there's a literacy to science too. If you don't understand that science takes a little bit of time, and people have to kind of look at things very closely to figure them out in their, you know, scientific pursuit. That concept is, it's not a common concept, I think, for most people that are not involved in science at all. So I think that really, you kind of have to go back to that. Because otherwise it looks like, oh, nobody knows what they're doing. They're always just changing their minds for no reason.
Right.
And I think that it's really important to go to that. Did you have anything to add to that, Julia?
I would say that for me and my experience with teaching, it wasn't so focused on science because these 3 lessons were happening in March, or not March, I'm sorry, in November. So we've grown and learned a lot. So we're a lot more stable with what we know. And it wasn't changing as rapidly as it was in March when Dory was teaching. The biggest changes that we had to keep up with were what the governor was saying in our state and reminding students that just because this is happening in Michigan doesn't mean it's happening in another state, because we do have learners from a few different states. So we would remind them to check their own health department, and if they had any questions about what their health department was recommending, they were free to ask. Mostly we just reiterated that 6 feet apart or 2 meters, wearing a mask, and reducing contact with others as much as possible. Those were the big emphasis in my lessons.
That's great. And I know you didn't have your slide up from today, but what were some of the resources that you recommended for learners with their mental health during COVID?
Well, for learners with mental health, we went over today a lot of coping strategies for stress and staying connected with friends and family. We talked about support systems. Those I think are influential, how exercise can play a role, journaling. There were a bunch of different recommendations. And at the end, we offered 2 resources that I had seen that Dory referenced earlier, was the Southwest Michigan Behavioral Health, as well as Griffin Place 211. Those are 2 resources that learners can call or go to for help with their mental health if it is getting to a point where it's no longer just a coping with daily stress.
Right.
That's what we focused on.
Great. Okay, there are no other questions in the chats. I'm looking.
Okay, so I did want to mention something when Julia said, we have learners from other states. That is one of the advantages of actually being online, is that we do have people that are not, maybe they started, and like Naomi's going to talk a little later, and she started in Kalamazoo, but recently has moved to Tennessee. But this has enabled her to continue because we're online. And in addition to learners, what we found in the summer program is that we had some classroom assistants and some volunteers that were from other areas. So we had a classroom assistant who was from Colorado that came in. And we even had one who has volunteered the last few years, but she was stuck in Australia. And she stayed up late to do classroom assistance with us from Australia. So that is one of the advantages, is that there are barriers that disappear when you go online. So earlier, they talked a little bit about this with the tutoring, but you don't have to worry about childcare. You don't have to worry about transportation, which are 2 big barriers. And then the whole idea of distance can be taken care of as well. Okay, so let's talk a little bit about the future of health literacy at the KLC. So the 12-week fall program is not quite over. Last week, was it last week that Liata did the food planning in an epidemic? She's already done that. But I wanted to include it here. There's also the third one down here, the health information for forms and emergency lessons, is one that I'm going to do in a couple of weeks on Friday, which is going to be helping people have their basic health information, like their doctors and the phone numbers, their medicine, their medical history, in a form that they can take, put it in their wallet or put it on their phone, or have it so that they can fill out forms when they go to see a doctor or when they go to an emergency room. We also have the health literacy tutor forum coming up So that'll start, and you can sign up for that here today. For those of you who are tutors, it's easy to put health literacy into your tutoring, and we can help you do that. We also, even if somebody doesn't want to be an ongoing tutor where they're meeting with the same person weekly, we could use some health literacy tutors who would sit down with a learner every once in a while and help them with certain health issues that they might have. It's not really, we're not talking about giving medical advice. We're talking about helping them find the information they need. For instance, I'm doing the health information for forms, but some of those might be very individualized, and a tutor would be great for an individual to work with an individual learner. So we will talk about some of that in the tutor forum. And also making some of the health lessons more accessible to tutors. And then we're going to have a virtual health fair, and I'm going to let Taylor talk a little bit about that.
So we are currently planning a virtual health fair. The date we have selected is February 5th of 2021 from 11 a.m. to 2 p.m. And there will be lots of information and emails and things going out prior to then. So if you don't remember that date right now, that's okay. You will hear about it again. But we have a probably 10 or so WMed students, first years, who are helping us with this health fair by presenting different topics. If you've ever been into a in-person virtual health fair, typically there's numerous tables focused around a specific subject where people can kind of float in between the tables, do activities, have handouts, and learn more about a specific subject while talking to someone who is, you know, a professional in that field or works in that field. Excuse me. So we will have a similar, I apologize, a similar setup with breakout rooms where the sessions will go about 15 minutes. We have not only WMed students presenting, but also different speakers from throughout the community in different organizations and in different aspects of health, which more of that information will be published as we get closer. And people can sign up for specific sessions that they'd like to go to and basically rotate in between the rooms to get varying knowledge on the subjects that they choose.
Great, thank you.
Hey, I have a comment. Hey, everybody, this is Keto. I just wanted to touch base real quickly on a point that Dory made about geography not being an issue or one of the benefits of being online. We have someone in our health literacy network, if you will. Her name is Marva Shodell, and she is the director, therapeutic area lead for Merck out in Pennsylvania. She's also the health literacy lead, and she found us online, reached out, wanted to know, I believe this was as we were doing the Read and Seed course, and started coming to class. She is just an amazing person. So part of her responsibility is in patient labeling, and clearly with everything happening so fast back in March with the pandemic. In fact, she and her husband both work in the field. So she was very much on the lookout for organizations like ours who were talking about COVID. And she came in, like I mentioned, when we were doing Read and Seed. And not only is she phenomenal in her professional area, but she's an avid gardener. She's extremely athletic. So she had so much to offer to the conversation. But as she was talking about the challenges that she faces in her professional life, you know, it was really phenomenal to have someone of her caliber and someone working, you know, in the field at that level, specifically about patient communication and health literacy, be a part of our classes, and for us to be able to offer that level of exposure to our learners. She has stayed engaged with us ever since that point. And we're just really fortunate that she found us and got so involved and has been quite vocal about how impressive our curriculum is. She's just been really complimentary. And Taylor, you can speak more about this because I know you guys have spoken as well, but she's just been an incredible asset. And it's someone that we, like I said, someone that found us online, but someone who, you know, we may not have been able to get her engaged to this level at any other time. So it was just really a testament to what we are doing, not to brag, but what the team is doing from a health literacy and a curriculum standpoint to have the support and the engagement and frankly the praise and the encouragement from someone like her. She wasn't able to make it today, but like I said, she's extremely involved and has just been a really great asset for us.
Thank you, Keto. That was great. Yeah, I think that we having people like that come is wonderful. And it also made me, I wanted to comment that all of our classes are open for tutors and others to come to as well. So it's an inclusive learner. It's not just the literacy and the English learners, but all of us are really learners here. Every one of us needs to learn more about health. So, Taylor, did you want to comment on that?
I mean, everything you said about Marva is completely accurate. We've been really, really lucky to have her around. But when you said the class is for tutors also, it made me think we have one specific person here, shout out Jim, who comes to like all of our health literacy classes. He's so fun in there. I'm so glad he comes and continues to come, and you should totally join because it's great for another opportunity for learners to interact with tutors as well.
Exactly. And you know, those that are learning English, you know, hear more people speak as well. So I think there's a lot of benefits to that. And it's a nice way of, if you are hesitant to tutor online, is to come and see how it works. So I think that makes a difference too. Okay, so our last speaker for today is actually one of our English language learners. And so I'm going to turn this over to Naomi. And I'm actually going to stop sharing my screen so we can actually see Naomi and see each other. So, Naomi?
Hi, hello. My name is Naomi. So I attended like many class of health of literacy.
Mm-hmm.
So, and then I learned a bunch of stuff like healthy thing and COVID. So every program is a very helpful for me because I don't have a TV in my house, and also I don't know the many words like Kobe and like a healthy thing. So then teacher taught to me a lot, and also I was Kalamazoo, so and since then I attended this program, and after that I moved to Tennessee. So now I'm living in Tennessee. So I'm surprising because I can attend this program, and even I moved another state. So I'm very appreciate that because when I come to Tennessee, I didn't have any place and any people. So who who teach me the English and another like another thing. So, but I could attend this program. Then I could I I learned English and another thing. So it's, I don't know. Kobe is not good, but uh, uh, sorry. Anyway, I'm glad to continue these programs. Even I moved to another state. So I'm really appreciate that who teach me a lot. So I appreciate the teacher, all of the teacher. Thank you so much.
Thank you for coming. You're always so active, Naomi. It's wonderful.
Yeah, thank you.
And do you think that it changed any ways in which you took care of your health? I know you were pretty healthy already, but were there any ideas that came to you in the classes that you feel comfortable talking about?
Oh, yes. So I'm usually do workout and
Yeah.
eat healthy food, but I never share my like a routine, like doing yoga and eat healthy. So I set my routine to like any student and teacher, and then I realized that oh I'm doing okay, so I have to keep my like lifestyle like a continuously. Yeah, it's good. It's really good thing because I realized that about for this program.
And I know that you're a very social person, and I know that COVID has been really hard for that. And moving and being around and not being able to be physically with people. So I'm always glad to see you in class.
Thank you.
Do we have questions?
We have a question for Naomi. Naomi, what lesson that did you learn that you liked the most, or that you learned the most, or you thought was the most effective?
Okay. Of course, I like a healthy program, but and also Kobe about Kobe program is very helpful for me because I didn't know how to process to to way to get the Kobe, and if uh, any Kobe situation, and I learned a lot of about Kobe from this program. Yeah.
That's great.
Yes. So I don't know if you see in the chat, Naomi, but there's several things in here about you.
Okay.
From Taylor, it says, I love having Naomi in classes.
Thank you.
So outgoing, and the learners all know her because she comes to so many classes.
Thank you.
And Jackie says, Naomi, we really appreciate you. You're a good student.
Yeah, me too.
Tito says, and she loves to eat.
Me too. I love it. I love to eat.
Okay, we're going to open up the questions to any questions for any of us, or what we're going to do in the future, or any thoughts.
I have a question for the interns. They've been able to take their learnings and actually put them into practice. So, what has that experience been like? Then you're learning stuff in the classroom and now you have to take it to an actual live class. And how has that been? And has there been anything that surprised you in the process?
Well, I would say that coming from, this is my first year of my master's of social work program, and I had no experience in social work in the past. I graduated with a degree in psychology and French from undergrad. So I would say that I was learning a lot from the KLC about the different ways that social work can apply, how varied it is, because I think I came into my master's program with a little bit of a limited understanding of what social work can do. And this has really expanded my understanding of what social work can do and how many different ways it can apply, and the focus on creating a community. So I've enjoyed taking that to my classes, and I've also enjoyed taking what I've learned from my classes to this.
Yeah, I'll add that to that too. So my program was interdisciplinary health services at Western Michigan. So it really taught me all about healthcare, and obviously my classes were centered around being a patient in the healthcare system and how us as like healthcare providers can better treat our patients, but also how patients can better interact with their providers or learn how to better effectively. And I never realized that I would get the opportunity to be able to like share that to like a community, especially during like a pandemic. So I think it's really cool that I can still like use my knowledge and educate other people from what I've learned about the healthcare system, and especially like during our difficult times with everyone visiting their doctors more than normal, and just trying to understand everything better about what's going on.
I think that a lot of students, this does open their eyes, I like what Julia said, to other possibilities and thinking through about what can be done. And I think the KLC is wonderful at letting students figure out what they can do and, fill a niche.
Great. That's great.
I just wanted to mention, as someone who came in as an intern and now is working in a professional role, it's definitely been an interesting experience because I never, I don't know, you go through social work classes and we talk about all of these, very prominent social justice issues, and literacy never once came up for me. And so when this became a discussion and I first met Michael and we had, a couple of meetings where I was learning about what I could possibly do at the KLC, like it opened my eyes so much, because it 100% is a social justice issue, but we don't talk about it in classes, like it is one. So for me, it was a really important perspective that now, like, no matter where I go in my professional life, it's going to stick with me, and it's going to be a position that I hold very strongly. So I'm very thankful for that. And I think like when I interact with, other people, I'm very eager to share that, because just we don't think about it when you have the privilege of being literate. You don't always think about it when it's not in your face every day like we are here. So it's just been really awesome, and I never would have saw myself doing this prior to my internship, but I love it so much, and it's it's exactly what I like to do. So it's just really cool.
And that's the great thing about internships. It kind of opens your eyes to what else is out there and what you can actually do. So it's great to hear.
Yeah.
I think going off of what Taylor said, and how social work is that, I think there's a value in the NASW Code of Ethics. So I don't remember what stands for, social workers, is a value of dignity and worth of the person. And the ethical principle is that social workers respect the inherent dignity and worth of the person. And I think that through improving literacy and access to the world by increasing literacy, that is respecting that dignity and worth of the person. And I think like what Taylor said, I'm not talking about literacy as a social justice issue in my class, and I think it's really overlooked because it does apply so well to the code of ethics that social workers live by.
I think that's a good point. And I also think that when you're looking at health literacy in particular, health literacy has to do with understanding how it works, how the system works, understanding the vocabulary, how do you go about doing things, being able to advocate for yourself. Those are all social justice issues. And health literacy is the one biggest predictor of our ability, our health status, how healthy we are, more than race, more than age, more than many other elements. So it's a very important element.
Right. Okay, I'm looking through, scrolling through, looking to see if there are any questions.
If I may interject something here. Something that has really surprised me is how widespread the need is for a program like this.
Yeah.
You know, like we all tend to take literacy for granted, and this whole program has been a real eye opener for me.
Mm-hmm. Good point.
Mm-hmm.
Does anyone have any comments then, if there are no questions?
I had a comment. I was just saying in the chat that at the KLC, I mean, on behalf of the staff and certainly our tutors, we're just so proud of our learners and how they've been so engaged throughout all of our health literacy programming. They are, what I say, they are enthusiastic for sure. You can almost feel Naomi's enthusiasm. They've been inquisitive, they've been consistent. Jim, again, has been in these classes since the beginning, and it's just really powerful because exactly to his point, you see the need, and these learners are struggling with not only literacy in terms of, you know, learning to read, but also language barriers and technology barriers. And they have just been amazing throughout the entire programming across the board. You know, I think Jesse mentioned this in an earlier session. We have been able to keep them engaged. They've been showing up. They let us know if they're having any sort of issues. Our navigators have just been outstanding on helping to remove those barriers, which actually is the next session. So didn't realize I was going to do that, but no segue. But yeah, it's just been a joy to watch, especially when we're talking about something as devastating as COVID has been. You know, we just want to basically shout out our learners. They've been amazing.
Yeah, definitely. Wonderful.
Yes, our learners, the staff, our interns, everyone. You guys have all been doing some wonderful work and making a difference, and we're just proud of all of you. So thank you so much. Thank you to our presenters today. This was wonderful. We learned so much. And for Naomi for speaking and talking about her experience. It's always great to hear from a learner. And, you know, it really opens up our eyes to so many more things. So thank you so much. And we're going to end.
Before we end, I just wanted to mention, going back to the idea of our impact is at KLC is when I did that series, that early series on COVID, I'm in an international website that's for people with health literacy that are trying to get information out about COVID. So I did post those PowerPoints, and they have been used in Canada, in New Mexico, in Colorado, and California for people like essential workers, for, you know, with community health workers, and they've been translated into Spanish. So not, again, one of those things that wouldn't happen if we didn't have the technology that we have to be able to, you know, kind of showcase what we're doing. So
That's wonderful. Thank you for sharing.
Mhm.
Okay, so we're going to end it here, and then we will see you back at 2 o'clock for our next session. Thank you.
Bye.
Thank you.
Thank
Thanks,
you.
everyone.